The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we are here with Lisa Wolfe-Schacter. She is a craniosacral therapist here in Austin, Texas. She and her family have lived here since 2019, and she's been working as a CST, because that's easier to say than craniosacral therapist, for 8 years. She works with bluescillacraniosacral out of the Harmony Collaborative Care space, and she is super passionate, not just about her work, but also about collaborative care model in general. So thank you so much for being here today, Lisa. We're excited to learn from you.
Thank you. I'm excited to be here.
Awesome. We're very excited to learn about this. I think this is something that Ciarra and I have been, kind of familiar with, but don't fully understand like all of the ins and outs about it. So we're excited to kind of start with you by learning about what this is. So to start us off, can you tell us what is craniosacral therapy?
Sure. So craniosacral therapy is a light touch form of manual therapy. So it's hands-on. And it uses that very light touch, not to be in that like woo-woo, ooey-groovy space, but to get very specific in what structures in the body that we're working with. So craniosacral therapy is a systemic therapy, and we can work with really any structure within the body, including the fascia, which is our connective tissue, membranes, organs, cranial nerves, really all the way through.
Amazing. And what kind of things does it help with?
That is also a very broad spectrum answer. It can help because it's a systemic therapy. It can really help with almost anything. And there's also an emotional component, somato-emotional component to how we get stress and injury in our body. And so craniosacral therapy also helps work with releasing that emotion that is stored in those tissues as well.
This is really interesting to me because I'm like, knowing I know almost nothing. She says we're familiar with it because we've heard about it so many times, because we have clients that have used it, but our knowledge base of what it is pretty limited. So I'm going to ask you like some questions just in my brain, what's coming up as you're speaking. When you say it's a light touch and it kind of hits wherever it needs to hit, does that mean no matter what someone's ailment is, you do the same things and it fixes whatever's wrong, or you do something specific depending on what someone's symptom is?
Yeah. So it's not like a blanket treatment that I do the same thing for everybody. Craniosacral therapy is specific so that we can really feel in the body and find restrictions, follow them to their origination, and help introduce the idea of release in the body. So, and you mentioned the word fix. So I do not fix people. I'm not in the business of fixing people. That is, the body is doing all the work. So craniosacral therapy is a facilitator, and I'm just really there to introduce the idea to the body and remind the body that we are all self-healing, self-correcting mechanisms, and like we have this within us to be able to heal and release and correct whatever we need to do within the body ourselves. And really a craniosacral therapist will just come in very neutrally with no agenda and follow the body where it leads them.
That's really fascinating to me because you're saying like you feel, and you said it's light touch, so like you're feeling and you're having to really be open to receiving like the information that the body's giving back to you. And I'm always so impressed, even with my chiropractor, like she can touch something and know that it's out. And I can't do that same thing. I don't have that knowledge, but it's just, I joke that she's like a magician. So it's kind of cool how you guys are able to really tap into the body when you're doing like this very light touch where someone else would touch and not feel anything. You're able to touch and really feel the difference in someone's body. So how would someone from just like me, anybody on the street, know that they even need this type of therapy? What kinds of things would they come to you for?
Yeah, a lot of people come to me when they've had chronic pain or they've like tried everything and they are still experiencing the same things over and over again. Also with it helps a lot with preconception, kind of getting the house in order kind of situation, to all the way through pregnancy, postpartum, and infants as well, like brand newborn infants, all the way through. It can help with things like torticollis, feeding difficulties, oral ties like tongue tie, lip tie, cheek ties. Really, most people find me because other people are like, "Oh, you're having this. You should go see a craniosacral therapist." Um, but really, I if you walk in the door, there's very few things where I'll say like, "This isn't going to work for you."
That's so interesting. I think we will oftentimes, as we're talking with moms that are having issues feeding their babies, we kind of have like our list of, okay, like, have we talked about this? Have we tried this? Have we, looked at that? And craniosacral therapy is something that we have on that list of things to try because we've seen it be really beneficial for babies that, do have maybe some of those feeding difficulties or the head movement things. And, as we're trying to knock out different things, it's a really great option for people who are, maybe wanting to avoid more of the, cutting a lip tie or something like that. Or they want to try some of these other things before they get there. So when we're talking about like those sorts of things, how long does it generally take for craniosacral therapy to like start helping?
So that's it's a varied question because bodies are different. So really, there's typically movement and change within that first session, but
Right.
in order to kind of resolve what's going on, that all depends on the person that is coming to see me, on what their goals are, um, and overall what their body's ready for. So, and also with people in general, but certainly with infants, sometimes their nervous system is running really really high, and their that reticular activating system, that kind of gear shift into fight or flight, can be really elevated, and craniosacral therapy can help like regulate that and lower that down so that the body can start to release and heal.
Interesting.
Really is interesting. And it's hard for us to wrap our mind around kind of because we don't have this experience with this modality. Like I've never received it myself. Right now I'm kind of like, maybe I need to go get craniosacral therapy. I've had TMJ issues and I have like pressure and all of these things. My shoulder never goes down. It's always up in my ear. So is this something that's generally like used? You said other people send them to you, so they're kind of doing multiple therapies at once, like they're seeing you and acupuncture and a chiropractor and all of these things, or do you prefer to just be working with someone on your own to see if what you're doing is working? I know you said you like collaborative care, so is that like at the same time?
It can be, yeah. Really, we like, again, I really am neutral. So whatever the goal of the person coming in is, I'm going to listen to that and help support those goals. If they're already seeing other therapists, then craniosacral therapy is a great addition to any other therapy. It works really well with chiropractic care, with occupational and physical therapy, with speech therapy, really all the things, IBCLCs, all of that. And it also is a great standalone therapy. And so it just really depends on what the goals are and where people are coming from when they come to see me. And sometimes I might even refer them out if, we're working on something and they have a real specific concern where that I know there's another modality that can get right at that concern, like very specifically, while I help work with them on why that's there.
Okay, and this is kind of a random question that was not on our list, so bear with me here. When I originally heard of craniosacral therapy, in my head, I was imagining like a very cranial focused thing. I was thinking about people like messing with mouths and I don't know, head massage or something like that. But then when you look at like the word craniosacral, that's like cranio, and then sacral would be like the sacrum. So why is it called that? And do you work like with the whole body?
Yeah, so it is systemic, and I can actually show you. Let me grab my little friend.
We love
here.
demos.
Okay, so this is the skull, the cranium. Inside, let me just pop this off for a second. Inside the skull is this membrane system. Ooh, God, need some craniosacral therapy here. Is this
if you're online, if you're on the podcast app, go open your YouTube app and come over and see our video. Cool. Scroll to this number of minutes on YouTube because this is awesome.
So this in here it's a membrane system that is made up of very tough membrane that is the same membrane that lines all the inside of the bone. So this is actually the second layer of it that folds in on itself and creates this membrane system. So it's kind of an intricate system. It looks, some people think like the Starship Enterprise a little bit, if you're nerdy like me.
Looks like a giant curl wave when somebody is surfing.
Yes. And there's this upper part that it separates the two hemispheres of the brain, the cerebrum, the cortex. And then back here, we have midbrain, brainstem, all of that is back here. And then this ring here comes out of the big hole at the back of the skull, which is called the foramen magnum. And you don't need to remember all this anatomy, the names of it. But that it sits right there, if you can see it in there. And that ring is the start of a tube that runs down the vertebral column to protect the spinal cord. And that tube is made up the same membrane because it's the same system with just a different name. So that tube starts here at the ring. This knot's not really there. It's just so I don't lose my girdle tube is what it's called. And it comes, if I were to add back that brown bone that you saw at the back of the skull, let me just do that really quickly. I like visual aids.
Me too. This is exciting.
So it would sit
Sam's
like this.
geeking out over there.
Yeah. This is that brown bone back here, that occipital bone. It comes down all the way through inside the vertebral column. It's stretchy. It's pretty free floating. It's full of cerebral spinal fluid. All the nerve roots that come out of the vertebral column branch off of this into sleeves that are from this tube that protect those nerve roots. And then it goes all the way down into the sacrum, which is that bone at the base of your spine, that triangular shaped bone that your tailbone attaches to. And it attaches at that second joint of the sacrum. And so it's one whole system. Let's see if I can get it all in view. There we go. It's one whole system and it works together. So there's a flow of cerebral spinal fluid from the top down and from the bottom up. And all the nerves come off of it, which is why it is a systemic, it's a systemic therapy and why it's called craniosacral therapy.
Oh, that makes so much
Wow.
sense. That's awesome.
We're like the cranium and the sacrum are not next to each other. Why is it called that?
Right.
This is
But we're all
really,
connected.
this is also really interesting to me because I used to go see a DO instead of like a normal doctor.
Mhm.
And I always had like such bad migraines. And he would do this thing where I would lie on my back, and he always had people like coming through his system, kind of watching him that were going through school. And he would put his fingers under the base of my neck and he would hold them in places. And he said, like, I had a big blockage in my fluid, that things were really restricted. And he would do this thing and he would just like hold it. And he had one of his students hold on the other side one time. And he's like, just wait for it with me, just wait for it. And then eventually the student looked at him and was like, whoa. And it took like 15 minutes of them holding some certain space, and it didn't hurt. Like, it was just a really gentle touch. But they were like helping unblock something, I guess. And my fluid started moving more freely. And he's like, this could really help with your migraines. Does that sound like craniosacral therapy? Is that what he was doing? I didn't know.
Yeah, so craniosacral therapy is born out of osteopathy. So DOs are
Okay.
doctors of osteopathy. When osteopathy started, it was really because there was, without getting too much into the history of osteopathy and craniosacral therapy, but this doctor who was kind of a Civil War doctor had seen a lot of people dying, and even his own family members, and he noticed that he wasn't really sure if they were dying because of the illnesses or injuries, or because of the interventions that medicine was providing. At that time, they were still giving mercury as a medication for people, and so he wanted a change. He wanted to change the system, and so he started this doctor of osteopathy like program, really from the bottom up. And then the people that came after him started to explore these different things in the skull, um, and so like you can see in the skull there are all these squiggly lines, and people thought, and some people still think, that it's one solid bone that fuses together, but that's not actually true, because like this is an infant skull and you can see there's more bones in it. This is a membrane right here in between these two bones, but in adult bones this is a fused bone. That's what it looks like. But there's still squiggly lines. And so there were people who were like, um, what are these there for? And so they did all these experiments, and found that there's actually movement in the skull, and that there's all these things are connected. And so osteopaths, if they're like true osteopaths from the root of osteopathy, it's kind of merged kind of with MDs now, with a lot of practitioners. But an osteopath that is like a doctor of osteopathic manual manipulation is going to have similar roots to craniosacral therapy, because the person who created craniosacral therapy, or the people, were osteopaths. And they just, one osteopath in particular was like, you know what? You don't need to go to medical school to know how to do this. You just need to calibrate your touch and know what the body feels like inside, and how to help facilitate change.
Well, I'm sorry if my question threw you off. That was a great answer, though.
Oh, no problem. It was a long-winded answer, but I hope you can follow.
We're geeking out on all the history and all of this. I love this stuff. It's so cool to learn like, how did we get here? I love all of that. So I think when a lot of people think of like anything with the word therapy in it, they're like, oh, well, obviously that's going to be covered by insurance. Is this something that can be covered by health insurance, or is generally covered by insurance, or is this mostly a cash pay situation?
This is a gray area for insurance. So craniosacral therapists have to have a license to touch. So their licensure can be in any modality that allows touch. So they can be osteopaths, they can be dentists, they can be PTs, they can be massage therapists. So it all varies, and what insurance will cover often depends on your licensure. I'm mostly cash pay. I can provide super bills for people if they have a referral from a referring provider that can provide a diagnosis. because the state of Texas doesn't allow me to diagnose with my licensure, which is LMT.
Interesting. Okay. That makes a lot of sense. So it kind of just will depend on like each provider basically on if they're able to have that covered by insurance.
Correct. The provider, also if there's referrals and people's insurance in general, that varies too. And the degree of how much is covered also varies.
Sure.
That sounds about on par with everything else in the whole world.
Yeah.
So to give us kind of an example or like a real life example of something that you've seen, can you tell us a time about where you've seen craniosacral therapy make a big difference in someone's life? Like, cool story if you're allowed to do that.
Yeah. I mean, I have had, I've had some infants in here with, who parents have brought them in because of head shape. And one in particular, there was a pretty severe brachiocephaly, which is where the back of the skull gets flattened from pressure, and mainly from babies who are laying on their back a lot and not a lot of tummy time, or not tolerating a lot of tummy time, or typically there's something else going on in the body that's kind of facilitating that that position where that pressure happens. So I had one baby who came in who the parent was really trying very hard to avoid having the baby in a helmet. And they were still pretty young. They were under 3 months. And that is typically the best time, if you're concerned about head shape, to go see a craniosacral therapist. But after 6 months, you'll probably end up looking at a helmet if you're, for those of you that are out there that are thinking, oh, should I try this or not? So anyway, this infant had really severe brachiocephaly, and I don't make any promises. Every body is different. And so, but I saw that infant a couple times a week for several weeks. And we got to a point where there was very minimal flattening in the back of the skull. It was much more rounded. There were still some parts, but it was much, much more round and not as angular. The face shape was much more symmetrical. And overall, it wasn't just the shape of the head that changed, but the baby's like demeanor totally changed. It was a really high stress baby, and really like was having difficulty sleeping and eating, and just like that colic diagnosis that people get. And after this course of treatment, they were like such a happy baby, laughing all the time. Sleep was great, feeding was improved, and the parent was super happy with the head shape as well. So that was kind of like a dream scenario with.
That's so cool.
Yeah.
And so, I mean, I know with babies specifically, like obviously their bodies are changing so quickly and there's so much growth happening that we probably can see results a lot quicker. But how cool that you got to see results like that so rapidly.
Yeah.
That's awesome.
That was exciting. That's always like when you can like take pictures and see like, oh, this has really changed from 1 week to the next, not just because the baby changed, but because like also with the aid of the therapy. So.
I love that. Well, thank you so much for coming on and sharing all of this. I think this has been super educational. I feel like at least I have a much better understanding of what craniosacral therapy is, and will feel much more confident sharing about it. So can you tell our listeners where they can find you and work with you if they are in the Austin area?
Yeah. So I'm the owner of bluescillacraniosacral, which again is located within the Harmony Collaborative Care Center in South Austin, over near the Westgate area. You can find me on Instagram at bluescillacraniosacral. Scilla is Scilla. And you can, my website is bluescillacst.com. And my email as well is info@bluescillacst.com.
That's awesome. And we'll put that in the show notes too, of course, so that people will have the correct spellings and all of that. Thank you so much for being here. This is really, really cool and informational. And we plan on having other people that are in the same realm. So having you as like the base of understanding what's going on here and kind of then spreading out from there is awesome. I also really loved the piece that you said about it being able to impact fertility, like when people are going on that journey, because we also want to do a fertility series. So that's a really cool little tie-in there as well. And we look forward to talking with you more another time. Thanks so much.
Great. Thank you so much. This was fun.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.